All right, clean freaks, Hank Balch back in studio here, episode 3 of our vendor management expert series through video. And we're talking to one of two of our experts today from the ReadySet Surgical team. Matt Strunk is back with us. And last time, Matt, we were talking about visibility in this process and why that's so key. And today we're going to switch gears a little bit and talk about the fear of this process, the fear of the unknown. And I know even as a sterile processing tech, there's something about hearing, hey, tomorrow is going to be a heavy ortho day that just strikes fear in the heart of anyone, especially if you're in the decontam side or maybe you're on the vendor table side that you're wrapping trays, you're containerizing trays. There's a level of fear that comes into that. But why is the unknown in this process such a big deal?
Yeah, you know what? I think when you look at the complexity of orthopedic instrumentation and how it's evolved, it's just really imperative that, the teams that are processing it are aware of what's coming, how to clean it, make it safe for patient care. A lot of times, things are coming in to decontamination. You may not necessarily know that a specific depth gauge comes apart, or, that you need to kind of take, a couple extra minutes to irrigate, some of the different reamers, things like that. So, having visibility to what's coming and making sure that, you have the supporting documentations to clean it, assemble it, make it safe for patient care is, really should be of the utmost importance.
Yeah, that compliance piece of this puzzle is so critical. Like you mentioned, the depth gauge or the additional time for soaking or for rinsing. And it highlights the difference that so many of these trays have as compared to the complexity of our normal like stainless steel surgical instruments, which many of those IFUs are very similar. They go through the same process. There's no additional ancillary steps here and there. But then you get into the loaner space and it's just all over the map. There's different times for ultrasonication. There's different times for rinsing. You got to actuate underneath the water. And then, yeah, you got these pieces that come apart. And it really highlights that, these devices, as compared to all the other devices, are the ones that sterile processing is typically the least familiar with, which means it's that much more important to have access to those IFUs that you mentioned.
Yeah, absolutely. And I think even to take it a step further, when you think about visibility of what's coming in, when you think of your surgical techs, they may be another team that hasn't had visibility to what's coming in. So, one of the great things with our technology is just providing, not only access to an IFU, but a technique guide or a stock photo of, what the tray should look like. So they get familiar with the layouts and, even a set list so they can identify, what particular trays are going to have the items that I'm looking for at a certain time in the procedure. So they're not, constantly having to look back or rummage through different trays. They're, able to familiarize themselves with it and, obviously, promote the best patient outcome as possible.
Matt, we've talked a little bit about the importance of the visibility piece and the unknown piece prior to the tray coming on site. But let's maybe focus now on the trays are here, and we know that because they were checked in. But then there's a fear of, yeah, but is it going to get from the check-in room through the process, through SPD, is going to get to my rooms? Why is that fear such a reality for many clinicians, especially in the OR, but also on the vendor side? Why do these vendors kind of, when they're saying their prayers at night, one of the prayers is, I hope my tray is where it should be when I come in at 6 o'clock the next morning?
Yeah, that's a great question. And I think, vendors are one of the, unique individuals that have a perspective of just how much volume is flowing through a sterile processing department. So, their inventory is one piece of the puzzle there. And I think, the fear is warranted. I mean, when you look at the thousands of items that are flowing through a department at any given time, those vendor trays are a small piece of that. And, you want to make sure that you're giving them, adequate time to, process the trays appropriately. And then when you look at things from the OR perspective, they have multiple cases they're supporting at any given day, so, the coordination and that siloed communication is something that, we really want to draw a light to say, you have visibility, whether it be in a technology or batched reporting, things like that. We really want to get them away from having to call or text, just to follow up with the, second shift team who already has too much to do as it is. So, uh, you know, just bringing those teams together and again, making sure everyone has visibility to those trays as they're moving through the process.
Yeah, I guess inherent to all this, there's two different teams in the background, or I guess maybe two different categories of people that we haven't talked about, and that's the surgeon and the patient. Clearly, if a tray gets lost in process, or it's not delivered, or the wrong trays are delivered, that's going to impact the surgeon. And if that happens a couple of times, these surgeons, they're not dummies. They realize that there's gaps in the process, and so, this unknown fear can start to creep in even to um, the providers themselves. And of course, the average patient is not even thinking that there's a chance that through the process and the schedule and the show up and the pre-op, there's not an inkling that, hey, my case could get delayed or canceled because this hospital doesn't have my trade. So, for those two parties, what impact does this level of visibility and transparency, what does that provide for surgeons and for the patients?
Yeah, I think if we start with the surgeon's perspective, there's no one better suited to, identify the appropriate inventory that's going to be needed. And then also if there's any changes that need to happen with that inventory, whether it be, you know, a metal allergy or anything that's kind of identified late in the process. So giving the surgeons visibility to exactly what's intended to be used by the vendor, what's coming in, gives them that opportunity to kind of make those last minute adjustments to make sure that the patient receives the outcome that is desired. And from the patient's perspective, really, there's enough anxiety there to last a lifetime when you're going in for surgery. So the fact that they may not have visibility or an understanding of the equipment coming in is almost a blessing in disguise because it's one less thing to worry about. But when you think of patients going from anesthesia or not eating for 24 hours, things like that, those are all things that you may not think of as top of mind, but those are things that factor into the equation when you delay or potentially cancel a procedure because a tray is not ready or something got lost in the mix. So, those are all things that we try to be mindful of and make sure that we are giving that information to the vendors and the vendors can appropriately provide, those status and that equipment to the hospital.
Yeah, it's real easy to forget that level of anxiety that's there for those patients, and the ripple effect that getting it wrong can have, not only on the patient, but their family members that have taken off work, the hours, the sometimes multiple days that they've had to prep and to travel, uh, only to arrive at the hospital and then be told that the process is so broken. They wouldn't use this term, right, but the process so broken that we can't even get the trays that we need on time for your procedure. That's not something any hospital, any clinician, any surgeon, any rep wants to be a part of. But that's the risk. And that's the challenge that, this particular process that we're talking about today is seeking to overcome. So, great call out in this episode, Matt. It's a great segue to what we're going to talk about in next month's release in operating at the top of license. Now, we had this conversation a little bit last fall during Sterile Processing Week to kind of set the tone and throw this phrase out there, but I'm really looking forward to diving back into it again in this expert series. So thank you for a fantastic interview. And for everyone who's tuning in, if you're not already subscribed to the channels to see the future releases of this expert series, please do so. Hit the subscribe button or the bell or follow us. And if you're not already connected to the Matthews of the ReadySet Surgical team that are part of this expert series, we're going to have their information in the description below. And as we tell you each and every week here at Beyond Clean, thanks for watching and keep fighting dirty.